Why? Because the screw is so large and close to the tip, and stress rise just below the nail, and then you have more fracture. Are you agree? Thank you. Then are changing. Screw less diameter, smaller, to avoid this problem. And when you look at this paper from Chris van der Werken, he said in 400 patients, he had more problem when you use the gamma nail, about more complications and fracture about 2%. Kurt Brown, 400 patients, similar results after 1 year and more complication with the short nail and femur fracture in 2%. Another paper show from the members of OTA, half use GHS and half use intermedullary nail. And then GHS, the people cost less, really. Maybe easier. Maybe the people like more to do, it's easy to do, okay? But the nail, it's an elegant surgery. Short incision, less operation time, okay? Many things to people begin to change. What about the fixation with the evidence? Look at this, short, you have with nail, less operation time. Really, the versatility is very good, and short incision. In the intermedullary nail, you have many advantages. I think with the time, the people use more and more nails. Because the nail, when you look at the biomechanical, looks better because the center of the head and the diaphragm is closer, then mechanical looks better. When you talk about this patient, 31, 82, 82 years old, and the nail, and look at this. Usually this nail, when you look at the lateral view, look, frequently, the nail go to the anterior, the anticurvatum. And in some patients, there is pain. How many of you have patients with pain just in case like this? Okay. How many have more than 3? More than 5? More than 10? If you operate more, you have more. What to do when you have this kind of pain? You change the nail? No, wait. Usually with the time, the pain goes out. Okay, but sometimes no, depends of the patient. And sometimes you have to change the nail, right? But there is this problem. Okay, look, this patient. Complication, short versus longus nails. Each implant is different. It had special characteristics. If you compare short and long, rate of complication, look at this. No difference between short or long. Okay? About 3.1%. 5 failure in short and 2.6 in long nail. Okay? It's a little less, but it's not really significant. And there is some fractures. Usually less than 3% of fracture below the nail. In the short, more in short and less in the long nail. Okay? This multi-center study show 5.4 failure for the entire, but 5.9 for short and 5.0 for long, short nail and long nail. Okay? If you look periprosthetic fracture, 2.0. more in short than 2.7 for long, 1.5 for 2.7 for short, 1.5 for long nail. Then you see just always a little more fraction, a little more complication with the short nails. Okay? When you compare in patients older than 65, when you use the new one nails, unfortunately, intermedullary nails have been associated with a high risk of later fracture around the implant. If any improvement been made to reduce the incidence, I think around the distal tip of the nail, I think is the way you have to work in this. The overall incidence was 1.7, okay, versus 2.6. Is still high than other. Then you have to study a little more to decide. Long nails tend to have lower risk of fracture. Okay? Secondary fracture around the proximal femur is one of the most significant fracture healing complications. This study suggests that continued design change to this method of fixation to reduce the risk of complication. Then always you go to this end. For a while you need to study more because you really don't have for a while the answer what is the better. But looks, I think the direction is maybe better nail and maybe long nail, okay? But long nail, somebody said, you can use long nail without lock. I would like to ask you, if you have a stable trochanteric fracture and you can use a long nail, maybe stable enough. You don't need lock, distal lock. You have to prove this. But this is the idea. But if it's unstable, you have to really have to look always at distal lock. But you have to study this. Then at the end, who decides? You. Your experience, the evidence, but really you decide. Thank you so much.